Assalamu alaikum. I would like to give some information about coronavirus. The virus we are dealing with called SARS-CoV-2 and the disease it causes called coronavirus disease 2019 or COVID-19 for short. So how does it spread? Bats are actually a natural reservoir of many viruses. So the virus can replicate inside the bat without making the bat sick, and then the bat passes it on to other animals. Finally, it gets passed on to humans. And that is what happened in Wuhan, China, after the first person was infected. The virus got passed from person to person by sneezing, coughing, and in just one cough, it can spread 3,000 droplets then that can go all over the place. So if anyone gets smacked in the face by someone's cough, he or she can get direct transmission of the virus. So who is at risk of catching? The answer is actually everyone. It doesn't actually matter what age you are, anybody can catch the virus. But elderly people, pregnant women, and people with underlying health conditions like lung disease, heart disease, diabetes, hypertension, autoimmune condition, those people are more vulnerable and they could get a worse version of the disease. So it's definitely not just the elderly that are affected, but they are the one who tend to have higher fatality rates. So what kind of symptoms are people actually presenting if they get coronavirus? Most common symptoms are fever, sore throat, cough, including shortness of breath. If we look for fever, people who are coming into the hospital, only about 43% of them had fever. But when they are in the hospital, 88% of them developed fever. And others less common symptoms are nausea, vomiting, diarrhea. About 3 to 5% of people get this kind of symptoms. So what should we do to prevent coronavirus? We need to wash our hands frequently, at least for about 20 seconds. And keeping social distancing to stop the spread and slow it down so curve will be flattened. And we should stay at home to make ourselves safe from coronavirus. But if anybody get these symptoms like fever, cough, shortness of breath, sore throat, what should we do? We should actually stay at home, don't panic, and pick the phone and call your healthcare provider. And another most important thing is to monitor your own symptoms and seeing anything is getting worse. But if you're getting shortness of breath and chest pain not getting away, or high fever and getting confused, even having a blue tinged lips, all of that would be signs that your condition is becoming severe. In that case, you should go to accident and emergency service for your treatment. But most of the cases, if they get COVID-19, they are going to be okay. Most of us we will recover at home. Most of us don't need to see a doctor or no need to go to the hospital, and we will be fine at home. But we have to be careful, and we have to watch out for severe symptoms. Thank you for listening.